Welcome everyone. Good morning, depending on where you are. It's 9 a.m. here in San Diego, California. I know we're going to have folks from all over attending this particular program. That's the nature of the topic, long distance caregiving. So we're very glad to have you with us. My name is Amy Abrams, and I am the Director of Education with Alzheimer's San Diego. And I am joined today by my colleague, Ellen, who is one of our clinical care coaches. If you were to call Monday through Friday, 8:30 to 5, we always have a team of clinicians who are ready to answer questions, provide support, connect you to resources. Ellen is a member of that team, so she may be a familiar voice to some of you, and now you can see her face. We're very grateful to Ellen, and I in particular really appreciate having her support here today. I see the chat. Thank you for having this on a Saturday. You are very welcome. We do get requests for evening and weekend programming. We do it as often as we can, and of course, this particular topic felt like a good one for that. So here is our agenda for this program on the topic of long distance caregiving. We're going to talk through, what the specific challenges of caring for somebody from a distance and somebody with dementia, right? That combination of factors. We're going to talk through what some of those challenges are, what you can do to get the information that you need to be an effective long distance caregiver, as well as to provide support. If there is a local caregiver, a local member of the person's support system, or a local member of your support system, what you can do to be an effective source of support to them as well. Sort of a piece of this that often gets kind of overlooked. We'll talk about sources of information. I am going to be sharing a lot of resources, the names of particular service providers, organizations, technological solutions. Again, we are going to be sending a copy of these slides out. You don't have to try to write everything down or visit every link that comes up today, because you will have that in your email within a couple of hours. So I hope that some of that will be helpful. I'll give you some tips on planning visits, since visiting our folks who are long distances from us is now, at least for the time being, becoming more possible, becoming more safe, and sharing some of those specific resources with you. So let's get started on the topic of caring for someone who is living with memory loss or some type of dementia from a distance. What I'd love to do is start by asking you this question. I think the word caregiver is something that brings up a lot of questions for people. People really wrestle with their identities as caregivers. So I want to just start by telling you how we use that word here at Alzheimer's San Diego. If you haven't seen the person face to face in months, or gosh, at this point, it could potentially even be years, are you really a caregiver? Yes, you don't have to be providing hands-on care. We think of it as if you care about somebody, you are their caregiver, right? If you are spending time, money, mental energy, your own resources in support of another person, then we call you a caregiver. Whether that word sort of rings true or accurate for you or not, just want to let you know we're including you in that definition. And what exactly is a long distance, right? I mean, gosh, over the past year and a half or so, many of us who are in the same location, in the same town as a person who's living with dementia, have not been able to visit. We have felt like long distance caregivers, even if we're just a few miles away. So the distance itself is not what's important, right? Your role as a caregiver, whether or not you are day in and day out providing hands-on care, or if you are thousands of miles away, but you are providing emotional support, technical support, helping get the bills paid, whatever those things might be, we call you a caregiver. So I would love to get a quick sense of, did my poll, hopefully my poll is showing, let me know if it's not. What I'd love to do is get your responses. Tell me a little bit about who you are. Okay, I see some responses coming in, so you must be able to see it. Just a couple of quick questions. This is anonymous. I don't know who's answering or what your answers are, but tell me whether or not you live in San Diego County. And then tell me how far away you live from the person that you're caring for, if that applies to you. Okay. Give this and you do have to answer both questions before you can hit that submit button. So if it doesn't apply, there is an NA option at the bottom of that second question. This is very helpful to me as I'm going through the program to sort of know who I'm talking to. And I can see here that we've got a pretty broad range of folks participating in this program here today. Okay, I'm gonna give that just another second in case anybody else is answering. And I'm not sure I'm going to be able to share my results. Something about my poll is a little wonky here today. It looks to me like we've got about a 60-40 split. 60% of you live in San Diego County, about 40% of you do not. Of course, I'm in San Diego County. Alzheimer San Diego is a local organization, but rest assured, we are going to be talking about how to find resources anywhere, not just here in San Diego County. How far away do you live from the person that you're caring for? Well over half of you, about 65, 2/3 of you live in different states from each other. So that's very interesting. 15% live in different countries. 10% are in the same city. But again, you can be in the same city, be in the same region, and absolutely feel like a long distance caregiver, that's for sure. Living in different cities or in the same state. Okay, great. Great. Oh, there, you can see the results yourself. Sorry about that. Okay. All right, great. I'm gonna go ahead and close that. If that poll window is still up in your view and in your way, just exit out in case it's kind of lingering on your screen there. But thank you very much. I appreciate being able to know who's here. It's one of the things I miss so much about being able to teach in person, not getting to know who's here. But again, this is a great topic for the webinar format. So let's talk about why it is so challenging to care for somebody who's living with dementia, particularly when you're doing so from a distance, right? We know it's hard to know that you are receiving timely, accurate, reliable, complete sources of information, right? Your instincts may be telling you, I feel like things are maybe going a little bit off the rails, right? The hairs on the back of my neck are standing up. Something in my gut, something about that conversation that we had yesterday is getting to me, but I don't know exactly what is going on. I can't see it. I can't smell it. I can't physically be there to see how they're doing. It can be very difficult for long distance caregivers to know, is it time, right? I know that, for example, I've got power of attorney for my parent. I know that when the time comes, when the doctor agrees that this person is no longer capable of making decisions for themselves, I'm going to have the ability and the authority to step in and be able to intervene. Do I know for sure that this is that time? Am I jumping the gun, or was it time a long time ago? You know, should I have intervened sooner? These questions come up for a lot of long distance caregivers. For many of us, we actually don't have that authority that we need. We're living at a distance and we don't have those documents in place, or maybe those documents were drafted, but we don't have access to them. We have limited ability or authority to intervene when we feel that we need to. A significant issue, just not knowing what's there, right? Here in San Diego County, it is a resource-rich community for people who are living with memory loss in terms of our county resources, private long-term care, supports, information, social service providers like Alzheimer San Diego, but many other great organizations. But if you don't live here, you don't know us, right? You don't know these neighborhoods, these communities. How do you find a good home care provider in a city that is, 100 miles, 1,000 miles, another country away from you? Just a lack of familiarity with what's out there and what's good is a real challenge. And then, of course, there's just logistics. So seeing how many of you are caring for someone in another state or another country tells me you are dealing with these logistical challenges, time differences, just finding hours in the day that you can talk to each other and connect with each other or with their caregivers if there's someone local, the travel time and expense that's involved in in visiting regularly, keeping abreast of what's going on with the person, right? So on that note, right, we recognize that you as a caregiver, a care partner, if you are caring for someone from a distance, this results in some major challenges for you, taking a lot of time out of your own life, either to travel and to, physically be away from your own home, your own family, your own responsibilities, or even just, sort of cutting into your leisure time, your mental health time, right? All of that is very important. It can be very difficult for long distance caregivers, even if they're not traveling. They're very likely having their days disrupted by phone calls, needs for care conferences and meetings, right? All of those challenges make it very difficult to manage one's own responsibilities as a long-term caregiver. Communication difficulties, I'll touch on this in a little more detail here in a moment, but it can be really hard to just to stay in touch with somebody who's living with memory loss from a distance. And no matter what you're doing, I know this firsthand. I'm seeing it happen in my own family at the moment. No matter what you're doing, no matter how much love and attention and energy you're investing in somebody, you always feel a little bit of guilt. Am I doing enough? Am I doing this the right way? There's a lot of second guessing. It just can be very hard to feel confident and reassured that you're doing the right things and that you're doing enough. So we feel a lot of guilt. It's very difficult depending on who this person is in your life. If this is your parent in particular, this can be really difficult to be in a position of having to take over some aspects of decision-making and responsibility for another person. Those shifting roles and responsibilities when you're with the person that you're caring for are significant and challenging, but there's also like sibling issues, other family, other members of the support system. We also have to negotiate our changing roles with them, right? You've always been mom's favorite, right? This is a dynamic that does not go away in our adult years, and we often have to try to set aside. Sometimes we can do it, sometimes we can't. We have to try to set aside some of that conflict. If we're not going to resolve it, we're just going to sort of push it aside for a bit so that we can focus on the person's need. Everyone has a different perspective, right? Literally and figuratively, everyone's got a different perspective on how the person with dementia is doing, what they need, what the best course of action to take will be, because we all are seeing this from different angles and we're seeing it through our own lenses. So for that reason, having some outside professional expert support can be really helpful. And I'll give you some suggestions on how to do that. So back to that important topic of the challenges of communicating with someone who's living with dementia. This is hard no matter how far away you are. Communication is a challenge for people who are face-to-face with each other as well. And I'll just say on the topic of communication, we do have a core education program that we offer here at Alzheimer San Diego on the topic of communication skills, how to initiate conversations, how to ask questions, how to connect and communicate with someone. I'm not focusing on that here today. We have a whole other program devoted to that topic, and you can find it in our webinar library. If we also offer it regularly as a live webinar, but today just sort of talking about, just logistically speaking, being on the phone with someone with dementia can be very hard when they're experiencing memory loss or confusion, right? Being able to recognize who you are, why you're calling, why you're asking them these questions. And then of course, back to that question of, is what you're hearing from the person an accurate picture of what's going on? No, a caregiver hasn't been. I haven't seen anybody here for days. I've been alone. I think for weeks, right? How accurate is that information? Right? That can certainly sound an alarm and should sound an alarm. But how do you know that the person just hasn't forgotten that the caregiver was just there, or that they're even still there? Right? They're just outside taking out the garbage right now. A person who's living with short-term memory loss has a hard time being able to report accurately. We also have the significant issue of how much insight does the person have into their own memory loss, right? If this is not somebody who recognizes that they have Alzheimer's disease or another form of dementia, if they don't remember that they don't remember things, right? They have no reason to question the accuracy of what they're reporting to you, right? To wonder whether or not that is when you respond with more questions or concern, right? It can be very hard for them to know if they're telling you something that isn't totally accurate, if they're misremembering something, right? It can be very hard for you to sort of clarify, are you sure about that? Because I think I talked to the caregiver when I was there, or when I called yesterday, right? Those types of communication challenges, difficult to overcome. There's also the issue of confabulation. This is a fancy word for what our brains do when there are gaps in a story, when there are gaps in our memory, and there always are, not just people with dementia. We all do this, right? Your brain fills in gaps and gives you the pieces of what it thinks are the pieces of information that you're missing. So often what you are hearing the person report to you is not true. It's a confabulation. It's something that their brain, their memory, a dream, right? Who knows, has told them has happened. This can be a source of tremendous confusion for the long distance caregiver who's trying to sort out what exactly happened here. And then there's also just the phones, the video conferencing can be hard to use. The manual dexterity that is required, the hearing, the visual acuity, right? The comprehension of what all of this technology is and how it works can be very difficult. So I'll give you some suggestions on some technology that can help with some of that, but just sort of acknowledging you are missing a lot when you are long distance, right? You might be able to talk to them every day or even several times a day. Using some of this technology that we have now, you might even be able to see them all day long, right? But you're still missing context when you're not face-to-face, when you're not physically with a person, right? So what are those pieces of information that are missing for us as long distance caregivers? We need to know how the person physically, how their physical health is, right? We often need to help with the scheduling of appointments, or if somebody else is in charge of the appointments as a long distance caregiver, what often happens is those appointments happen and you never hear what the outcome was, right? Okay, so I know there was a neurology visit yesterday. What exactly happened? What do we know about their status and how they've changed since last time, right? So getting other people to communicate with you is a major task of the long distance caregiver. And by the way, I just want to say, if you are one of these long distance caregivers who needs better, clearer, more regular information from a primary caregiver, you are welcome to share this webinar, these resources with them as well, right? We want everybody sort of needs to hear and know what everyone else needs. And if my saying it, my delivering that information is easier, then so much the better. So please feel free to do that. What's going on in the house? Right? This is a big challenge, whether somebody lives in a private home, a family home, an apartment, or a house by themselves or with care, or if they live in residential care. It can just be sort of hard to know the day-to-day. Who's coming to visit? Did that delivery come when it was supposed to? What is the status? Is the house clean, right? Did the person who agreed to come by and clean up once a week, have they been making those visits? Right? Probably one of the trickiest areas for the long distance caregiver is the financial stuff, right? And here again, I want to point you toward another webinar that we offer, another one of our core programs called Legal and Financial Basics. There is a recording of it in our webinar library. We do offer it as a live program pretty regularly to help you sort of get a handle on what documents you need, what you can do if somebody is already living with dementia and you don't have those documents in place, what your options are. But being able to help somebody manage their own finances, this is one of the hardest, because of, sort of the logistics and the privacy. Banks don't just let you, hi, I'm so-and-so's daughter. I need to be added to her account, right? Doesn't quite work that way in most banks and most cities in America these days. There's a lot of security around a person's financial and legal information. You have to have the right documentation. Sometimes you have to have specific documentation just for that one institution, right? You might have general power of attorney, but it doesn't work for that particular bank. You got to get this whole other document signed in order to be able to gain access to the person's information. So there's the need for financial information, the logistics of getting permission, but also just the sort of emotional aspect of that. This is one of the areas where it is the most difficult for somebody to open up their life and share with other people. Yes, I need help with getting my bills paid. Here's, all my login information. Please support me with this, right? It's a blessing if somebody were to say that to you as a caregiver. It's a real rarity though, right? Often these are very difficult conversations, but they are important conversations for us to be having. So again, I want to refer you to that program for more information, more details on the documents themselves, but I'll go through some of the basics here today. I think generally we just want to know kind of daily life. How's the person doing in this age of, living in a pandemic? Are they safe? What's going on with them locally, right? What are the local mandates and mask requirements, the protocols for in-home care providers or residential care communities, right? Just being able to keep up with that stuff in your own life is hard enough, but you also need to know how to access it in another county, in another region. So with regard to the trickiness of gaining access to this information, a couple of quick tips. And again, I'm going to point you toward resources at the end for all specific resources for all of these things. But if advanced healthcare directives have not yet been written and the person still does have decision-making capacity, now is the time. And I mean, like this afternoon. This is a very important set of paperwork to get in place. This is how you grant somebody power of attorney for making your healthcare decisions, and you give them detailed information about what it is that you want or don't want. A person who has a diagnosis of Alzheimer's or another type of dementia is not prohibited from creating new documents, as long as they, you don't necessarily lose all your decision-making capacity just because you get that diagnosis, right? So if they are still able to participate in this process, I encourage you to get these documents drafted as quickly as possible. You don't need attorneys to do this. You can download statutory forms, get them signed, notarized, or witnessed as is required in the person's particular state, so that you or whoever the person's agent for power of attorney is going to be able to access what they need and step in when they can. If the person, by the way, already has advanced healthcare directives in place, if there are power of attorney documents that have been drafted, they never expire. They can be overwritten. If a new one gets written that has a later date, then that's the accurate one. But if those documents already exist, find them, right? Get your hands on them. If you are the person who's got agency, power of attorney agency for another person, get your hands on that document, the original if you can, or a scanned or photocopy if needed as well, will also work depending on the institution. But try to obtain this documentation now. Whether or not it's time for you to use it doesn't matter, right? You don't want to be scrambling for this at the moment that you need to step in and take over decision making for another person. Conservatorship is California's word for guardianship. That's the term that's used in pretty much every other state in the US. Wherein if a person did not name somebody to be their decision maker and they are no longer capable of making their own decisions, medically, legally, financially, whatever the case may be, a person they basically have to be sued in a court, and a judge grants somebody else permission to be their guardian or to be their conservator, as we call it here in California. It's an extreme process. It's expensive. It's sort of the last resort, but it is something that is available for people who need someone else to step in and make decisions, who didn't do that planning, who weren't able to do it or just chose not to. And there are such things as public guardians in the event that there isn't a family who's able to do that. I would recommend, as well as getting a hold of advanced healthcare directives, HIPAA waivers, other release forms. This is kind of healthcare providers as well as banks. Many of them have their own versions of these. So there is a general HIPAA waiver. There is a general power of attorney form, for example, but often, Kaiser, for example, has its own, you don't use a general HIPAA form for Kaiser. Kaiser's got its own release of privacy information. Banks often require, in addition to seeing a copy of a general power of attorney, they've got their own form that the person needs to come in and sign in order to add somebody else on or give them permission as a signatory or to add somebody else to an account or to be a decision maker. So reach out to those institutions where the person's information is held. Now, if or hopefully it's before a crisis, you may already be in a crisis, I acknowledge that. But what you don't want to be doing is scrambling for access to information in the midst of a crisis, if you can avoid it at all possible. Another important thing to be thinking about is just digital access to a person's life. As time goes by, more and more people living with dementia are people with very robust digital lives, right? They've got social media accounts, they've paid all their bills online for many years. All of that information is, password protected. So this is a big obstacle, but a very important step that the long distance caregiver needs to take. Somebody local or you as the long distance caregiver, somebody needs access to these accounts to find out the password. So, this isn't always possible. There are always analog workarounds, somebody who's got advanced dementia, only they know their password, right? If you work with the institution and you've got legal decision-making authority, there is always a workaround, but I'm not going to lie to you, it is challenging, right? Getting paperwork signed, getting the person's confirmation, right, and support. But there are always workarounds, but they're not always easy. One thing that was recommended to me by a fiduciary, professional fiduciary, that I really appreciated was the existence of remote access, right? If you can set up desktop sharing so that you can log in to that person's computer, right? With their permission, of course. It's better if you can do this with them. Now here, let me have a look. Let's look around your folders. Let's log in, do your banking, get the bills paid, do those things together. So much the better if that's possible. But there are, a remote desktop is one application that you can use. There are sort of user-friendly versions of this software that allow somebody to log in remotely and support somebody in their digital life and their digital safety from a distance. Again, we'll provide some specific resources as we go along here. Just want to sort of lay out the array of challenges and needs that you may have, things you may be, hopefully this is bringing to mind some things that you hadn't thought of before. Okay, so let's talk now about what we can do as long distance caregivers to support the folks who are local. First, ask, right? I think because we tend, not always, but we tend to know the person pretty well. Let's say I am a daughter caring for a parent from a distance. The most local source of support is likely to be somebody that I know pretty well. It might be my father, my stepfather. It might be my mother's best friend. It might be another sibling, right? It is probably somebody that I know. We tend to sort of assume that we know what they're doing. We know what they need, we know how best to support them because it's somebody that's been in our life for a long time. I recognize that is not always the case, but if it is, I just challenge us all not to make assumptions about what we know and what it is that we think they need. Ask the person, how is it that I can be most helpful to you? Reflect for a moment on what you're good at. What are your strengths? Maybe, you are too far away to be the person who helps with bath time, twice a week. That's not something that you can do. But are you really skilled at doing research? Could you be the person who identifies resources for in-home care and sort of takes some of that sort of technological burden off of the local caregiver? Consider whether or not there is any possibility for you to give the local caregiver a break. I think caregivers just plain and simple, they need opportunities to take a break. Caring for somebody who's living with dementia day in and day out is an absolutely physically and emotionally exhausting task, even if the person's symptoms are very mild and they're a pretty easy person, right? There is a lot that we're all dealing with, no matter how close or far we are in terms of our emotional responses to seeing somebody losing their memory or experiencing cognitive changes, seeing personality changes, seeing functional losses. These are significant challenges and caregivers absolutely need a break. So is there something you can do to facilitate a break for them? You going out and being that person for a day or a week, right, or a month, or who knows, or helping them round up some professional support, helping them figure out a temporary placement in a care facility for the person so that they can get a little bit of a break, right? Don't rely on the local caregiver to tell you that they need a break. They might not always be able to articulate that. Right? Come to classes, keep learning, learn more about dementia, help the local caregiver learn more about dementia, help them find opportunities for education, skill building, training. Being a caregiver to somebody with dementia is not easy, and it doesn't come naturally for most people. It's like all the normal kind of rules of communication and engagement kind of don't apply. You have to learn a whole new skill set. So support them in helping them identify opportunities to take classes, find support groups, connect to those local resources. So some ideas of things that the person with dementia or their care partner might need here, right? Help around the house, shopping, errands, transportation resources, a really big one. Most people with dementia, actually, frankly, most of us, regardless of whether or not we develop dementia, are going to outlive our ability to drive safely. So being able to think ahead about transportation resources is a hugely important task for all of us as caregivers to another person to mitigate the effects of isolation, boredom, lack of activity that can sometimes happen if a person doesn't have transportation. Social activities, emotional support. I think often we get real focused on making sure the person's got, a clean house, 3 meals a day, a bath or shower a couple of times a week. And we sort of forget the importance of also keeping them active, socially engaged, connected to their friends or activities that they love. Even if they're a pretty solo loner type of a person, they still need stimulation, activity in their life, sources of emotional support. Okay, you can help a local caregiver by requesting what's called a home safety assessment. You can hire private individuals to do this, or doctors can sometimes order a occupational therapist or a physical therapist to come out to the home to do a home safety evaluation, to make some recommendations on how to help the person be more safe or more mobile in their home environment. And that can be covered by health insurance. Help with medication management, huge challenge for any person with dementia who lives alone. This is a major safety risk and something we absolutely need to be attuned to. There are automated systems for managing medications, but I'll tell you, in my experience, it usually requires the assistance of another human. Right, medications are very tricky. So whether it's getting help from a local pharmacist and figuring out how to bubble pack medications to make them safer, or just asking, the neighbor to come over once a week and do a med setup, whatever the solution might be, in my experience, it does usually require the help of another person. Very hard to manage independently when you're living with memory loss. Manage safely. Of course, bill paying, financial management, as we've been talking about, a huge need for people who are living with memory loss. For a lot of folks, this is sort of the thing that tipped off their family, right? That things were not going well, bills not getting paid, missing, making insurance premium payments, those types of things, being alerted. So there are bill paying services, professional fiduciaries who can provide that kind of hands-on local support and be a liaison to long distance caregivers too. Legal help, finding in-home care resources, locating good adult day programs or residential care options. And if a person is in fact going to be moving out of the home, there's the sort of challenge of all that stuff, right? Packing, moving. So all of these are just some examples of some of those resource needs that long distance caregivers have. How do we go about finding them? Right? So first, the local support system, and I'm talking about just like the people in their life. This is a really important, that personal safety net, the neighborhood, the people, their long-term friends, your long-term friends, the people who know them, members of their church, members of their book club, of course, things like their doctors, their lawyers, their CPAs. All those professional advisors are very critical sources of information and support to you as a long distance caregiver. Do not be afraid to reach out to them. Sometimes there are privacy issues and they can't or won't communicate back to you. You can always communicate one way, right? That lets the person know, I'm this person's caregiver. I'm concerned about them. Here's how you could reach me, providing them your information, telling them what your concerns are. I'm a real believer in that there's a mix or a balance we have to achieve in terms of protecting somebody's privacy, right? Their right to keep their own diagnosis, their own health status, what's going on with them to themselves. That is a very important right that we all have. And then you have to balance that with when you've got a person with limited decision-making capacity and a progressive condition like Alzheimer's disease or vascular or Lewy body dementia, another type of dementia that we can unfortunately expect to progress and get worse. We have to make there's some type of shift in the balance we have to make in order to keep that person safe, right? So talking to the neighbors, right? Letting people know, if you see my mom out walking by herself, here is my cell phone number, or here is my sister's cell phone number. She's close by. Please let us know, right? Just engaging other people to be part of the support system, super important. And they also can be an incredible source of information about who's a good housekeeper, who's a good person to come by and walk the dogs twice a day, who have you used to help you with in-home care, managing medications, what memory care, what adult day programs around here are helpful. If you're not local, you can't visit, right? Please reach out to those members of the support system for their advice. Right. Professional advisors, I'm going to give you some suggestions on who and how to reach out to a couple of these. But also, if you don't have access to Fiduciary, a professional care manager, if there's not an agency like Alzheimer's San Diego in the community where the person that you're caring for lives, if you don't know the person's personal network, or maybe they don't have one, right? That's entirely possible. Please reach out to their local area agency on aging. Every region in the United States is required to have an area agency on aging, a AAA. You can find the one that covers your person's, region, even very, every major metropolitan area has one, but every region is covered by one. So in rural areas, there is for every city, every town, everywhere, there is a local area agency on aging, and you can find them through that website, which is operated by the federal government. I think it's called the Elder Care Locator. So if you just don't have access to an individual professional that supports that area, or a particular personal connection to somebody, reach out to your local area agency on aging, and they will be able to give you some information about that. Finding those local dementia organizations. I'm going to, again, at the end, I'm going to give you the list of other organizations like ours around the country, but also help you figure out how to find other support organizations across the United States. Don't forget to just ask around those other community resources that are out there. These are great sources of information. Talk to the people at the closest public library, the local senior center, the coffee shop where people go, right? Every community has got its place where information is shared, resources and support are provided. Sometimes it's an official senior center. Sometimes it's totally unofficial. It's the post office, right? Thinking about different communities, but connect with those local resources and ask them, right? If you are in need of information, resources, some of those types of information that I laid out in the last few slides there. And then of course, you can look online, right? Lots of risk involved in that. Of course, I don't want anybody hiring professional caregivers through Craigslist or anything like that. But don't hesitate to do online searching. Do it in a smart way, right? Using authoritative sources for information, and just recognizing when you are on an advertiser-driven website, which is usually a .com, right? It doesn't mean that that's bad information, but it is biased information. So just take that information with a grain of salt. A couple of suggestions and ideas for locating a couple of these types of professionals that I've been talking about. Aging life care professionals. This is an independent private professional that families can hire. Clients can hire them individually. They rarely do. Usually families hire aging life care professionals. They're also referred to as care managers. That's sort of old terminology. Today, they're mostly referred to as aging life care professionals. These are generally nurses, social workers, gerontologists, counselors, people with a background in a related field who work privately. They've obtained certification and they work privately as a one-on-one advocate for an individual person or a family. Very helpful for the long distance caregiver. There are care managers all over the United States, Canada, Mexico, other countries as well. Mostly, of course, this is an American phenomenon because we tend to be so spread out as families here in the United States. They can really be a good professional, objective set of eyes and ears if you don't have somebody close by, or even if you do, and you just want a professional source of expertise, somebody to run ideas by, somebody to monitor and oversee in-home care, for example, or help facilitate a smooth transition into assisted living or memory care, for example. So they can just really help people kind of prioritize, navigate these complicated systems, and help people manage and share their responsibilities. There are, of course, fees for this. This is not a free service. Most of them charge on an hourly basis. Some do kind of project work, or they'll just charge flat fees for things, but for the most part, they charge an hourly rate, and it just depends on where in the country they are and what kind of work they're doing. But I see rates anywhere from $100 to $300 an hour. Pretty standard. So aginglifecare.org is where you can find information about that and referrals to individual people by looking up by zip code or city. And then I mentioned professional fiduciaries. So this is something that is unique to California, in that we are the only state where professional fiduciaries who serve in the role of trustee, conservator, in other states this would be called a guardian. They manage a person's estate. They may serve as the executor of the estate. They could do daily money management, paying the bills, going through the mail, right? That day-to-day stuff, not just the big high-level stuff. Being a person's agent for healthcare, power of attorney for healthcare, for finances. These fiduciaries in the state of California are licensed. If you're doing this professionally, if you're doing this for 2 or more people in the state of California, then you have to hold a license in order to do that. Other states the regulations are different. There is no other state that requires licensure for fiduciaries at this time, but there are people doing the work, doing fiduciary work just about everywhere. Many of them are attorneys. So this would be another, if you don't know, in California, you can find a fiduciary just about anywhere by going to the the PFAC website, the Professional Fiduciaries Association of California. You can find referrals to people in pretty much throughout the state of California, but elsewhere, I would refer you back to that elder care locator if you are in need of a professional to step in and take over some of these responsibilities for someone. So again, I'm going to go through specific resources at the end, but I want to pause and see what questions have come in, Ellen.
One question, and then something I think you may want to give some feedback to.
Okay.
Okay. The question, how do you vet resources? We're going to be providing resources at the end so they can know we've vetted those, but how about resources in other areas? How do you vet them?
Well, it really, it depends on the resource, but this is where, I would, you don't want to just, find something online and hire them and, assume that they're good. This is where you do want to try to get some feedback from other members of a local support system, talking to individual people who have used that service, asking for references, depending on what, if it's home care, if it's a residential care facility, you can find reviews online if you don't have a trusted personal source of information or support. If there is an organization like ours where the person is, this is a great way to do that, right? At Alzheimer San Diego, we won't tell you you should move your loved one into this particular memory care facility, but we can tell you what their licensing status is, right? When their most recent inspection was and how they did, help you find that information, but answer some basic questions about how to go about vetting a particular resource. So it really kind of depends on what it is that you're looking for. But vetting is critically important if you possibly can.
And then someone, when you were speaking earlier about the agencies on aging in local areas, the response was the one near her parents' home, near the home in question, was 3.5 hours away and had zero information on what was available in the community, unable to find a way to help parents stay in the home because there were no resources due to where they live.
Right. Yeah, if it sounds like this was probably a pretty remote and rural area. And that is a reality. If there aren't services, then there's nothing for the area agency on aging to connect you to, right? That they can't refer you to resources from out of thin air. If they don't exist, they don't exist. That's absolutely true. And I appreciate that you brought that up. There are areas of the country, many areas of this huge country, where there really are not close by local resources. And so the question becomes, is this a safe place for a person to stay, right, by themselves? If they are living with a progressive condition like Alzheimer's disease or dementia, and they are in an area where they don't have any support, and there are no local healthcare, long-term care resources, social service providers anywhere, for miles away, this is probably not a safe place for that person to age in place, to remain on a long-term basis. So this may have to trigger that conversation about getting power of attorney, seeking a conservatorship or a guardianship in order to relocate that person, or hire somebody, make arrangements for family to move, right? That's not really realistic for most family caregivers. But yeah, there are regions where the support doesn't exist, and they can't refer you to something that's not there. Yeah.
Thank you, Amy.
Yeah, great question. Anything else? Okay. All right, we will keep moving. We are going to break again for more questions in a moment. We're in a few moments. We're going to talk now for a little bit about the solutions that are available with regard to technology. Before we get into that, I'm going to show you this short video that was shared to me at the American Society on Aging conference a few years ago that has always really tickled me. It's lighthearted, but it does, I think it does send an important message. So Ellen, please let me know if my audio is not working and you can't hear this. Hopefully I've set this up correctly.
tipping forecast issued by the Met Office at 22:40 on Saturday the 18th. There are warnings of gales in all areas except Trafalgar. The general synopsis at 1800, Iceland 960, drifting slowly east and filling. Low 250 miles northeast of the Faroes 9540 by 1800 Sunday. High Trafalgar 1033, slow moving with little change. The area forecast for the next 24 hours. Viking north and south Utsira 40.
Is it Chinese? Is it Japanese? James thinks it's Chinese.
This little vase is Japanese, and there are there are several things that we look at. If we first look at the little band that encircles the neck.
Serious about that? You know, I've never heard.
They say 150 pounds, 150. Area pounds and 50, 80, 90 pounds. Area pounds and 90 pounds. All done at
29% swing.
We are seeing the entire shape of British politics changing before our eyes.
Look at that. It is right up. It's almost breaking our swingometer.
Horrifying column that for the Lib Dems, down 27%.
Viking, northwest 5 or 6, wintry showers, good, occasionally poor. North at Sierra, south at Sierra, east 40s, variable 4, becoming southeasterly 5 or 6, west 40s, Cromarty, 4th, Tyne, west Dogger.
Noel Wiley, no red line for you as your high score. But let's see, Noel Wiley, is it right? How many people say?
Serving the captive all on here, 254.
No, I think he probably will. I mean, it comes down. I tell you what, you've got several years.
Watch some of those. Okay.
I can heartily recommend.
Do the pointless thing of making up names. That stacks the odds against me.
Yeah, I'm thinking Brown's
Now in winter, the sharks are focusing all their attention on the offshore islands, full of young seals. By watching how the sharks hunt here, Alison has learned what time of day an attack is most likely.
Here's the general synopsis at 0700 GMT. Cow in sea area Shannon moving slowly eastwards and filling. Sorry, that should be low in sea area Shannon. And now the area reports. Viking, north of Sierra, south of Sierra, rain at times, good. Westerly becoming cyclonic, good. Humber, Thames, Bedford, Leyland, Daff, Dover, Seoul, Hayth, rain at times, good. White, Portland, Plymouth.
Subway systems from around the world. We need you to tell us in which city your systems, please. Best of luck.
Okay, let's reveal our 5 subway systems, and here they come. We have got that made you think Paris, New York City from Andy and Julian. 50. David and Rachel are going to say. Is it going to be 15 though? That's 7. Very well done indeed.
Two nice cycling makers, it's so many films and what have you, isn't it? Now, A is London.
Shink of light getting inside the telescope. The astronauts had to get the latch to lock.
Houston, if you copy, Jeff's just working putting the doors back together and thinks he's managed to close the gap. And we're going to press on. If you've got a way to do it, do it.
Trap and a ratchet. Floating Story Musgrave improvised a solution. It was a success. The astronauts were elated.
I love this video. I'm gonna get that to advance. There we go. I think that does such a great job of, in a playful way, of showing the limits of all of this amazing technology that exists for us. It also, I think, sort of it tugs at my heartstrings, these well-meaning, loving children who just want dad to eat his vegetables and get exercise and get sleep and make sure he's safe. All of their well-meaning efforts, you can see how just oppressive that feels to him. That video is called Uninvited Guests, right? He's living with all of this surveillance. And I know, that is a major barrier and obstacle to a lot of long distance caregivers, using technology, surveillance in a way that is still, loving, supportive, allowing the person some what we call the dignity of risk, right? The risk is a part of being an adult, right? So we can't protect people from every possible thing that might happen to them. We can't prevent every fall. We can't prevent every episode of getting lost and wandering, medication errors, right? Trips, cuts, burns, those types of things. Being in a car, right? On your way to that doctor's appointment that you encourage somebody to go to, there could be an accident in the car, right? Risk is a part of life, and as long distance caregivers, we have to figure out how to manage that and how to balance that for the person that we're caring for. But technology solutions can be a real source of support, and I don't mean to be flip with the video and overlook them. While certainly there are limits, there is also a lot of really good stuff out there. So on this table and the one that follows, I've laid out for you a couple of types of technology supports that are available for long distance caregivers, helpful to local caregivers too, by the way, and a few examples of what I mean by them. And I'm not gonna pull up websites and show you all the details and the ins and outs of these particular providers, but want to make sure that you know that these types of technology exist. These aren't, this is not an endorsement. These are just a few examples that we've come up with to tell you about these types of technologies. So you can arrange for automated check-in calls, reminder systems. There's a neat service called Care Angel. So it's not an actual person, but it is an automated service that makes a daily phone call to a person who is living alone and needs a check-in. Of course, there are also volunteer human-led programs that do this in many areas. We have a couple of them here in San Diego County. But if that's not something that's available in your person's area, you can set up an automated phone call to check in on them. Personal emergency response systems. I think most of us are pretty familiar with these. These are the buttons, the pendant you can wear on your neck, on your wrist, that you push for help if you need it. A challenge, of course, for a person who's living with dementia to remember to push the button, but this can be a good source of support if there's a primary care partner who lives in the home. We'd like for them to have one of these systems in place so that they could call for help in the event that they needed something. The person with dementia might not be able to, in a moment of stress, worry, confusion, might not be able to call for help for them. Right, so personal emergency response systems are not just for the person who's living with dementia, they're for the whole household there. Lots of people using wearable technology now, right? Activity trackers, Fitbits, Apple Watches, and the like can be used to track not only how many steps a person is taking, but there are things like heart rate monitors, there are fall detection technologies that can be incorporated into those wearables to help a long distance caregiver know if somebody hasn't gotten out of bed, it has fallen, right, is having some type of is in need of some type of help, might allow you to intervene sooner than you otherwise could have. These information portals, this is a real boon for the long distance caregiver. I was talking about the challenges of keeping up with appointments and visits and just getting information, sharing information. Sometimes there's a really wonderful local caregiver, but they're really bad at keeping everybody updated, right? Because it's a lot of work. Who have I told? Who needs what information? You can set up a secure online portal. It's like a little secure website about that person's care. Caring Bridge is the first and oldest of these. There's a free version. There are paid versions that are fancier, but there are also mobile apps for this and other online sites too. This is a wonderful resource where for families where there's a lot of moving parts, right? A lot of people want information, need information, but you can set it up and decide who has access to this portal. It's not like putting everything out on Facebook, right? It's a secure portal. People log in and you determine who gets what kind of information. So people can also use this to set up weekly visitation schedules. Okay, I'll go visit on Mondays, you go on Wednesdays, I'll bring dinners over on Friday, right? Those types of care arrangements too, not just sort of medical information, but the good fun stuff too. Communication tools. I saw in the chat there was a recommendation about caption call, the caption phones for people who are living with hearing loss, deaf or any type of hearing loss. In addition to that, which is a great suggestion, in addition to that, there are also just phones that are easier for people with limited dexterity, memory loss, cognitive ability to use. A couple of examples of those, the Lively phone, to be called the Jitterbug, the Lively phone, as well as Raz is a one screen picture phone that's been developed specifically for people with cognitive and intellectual disabilities, a really nice resource. I mentioned the limits of automatic pill dispensers, but if there is also a person involved, they can be a terrific technology, right? These things that you set up in advance and they're locked, and a little carousel turns and administers medications on a regular schedule can be helpful. But again, I wouldn't rely on that as the be all end all, but there are a couple really good technologies out there. Health and safety monitors and sensors at home. ADT, the home security company, can help you set up, things like in the video. It's not so far-fetched. There are technologies that allow you to see if a refrigerator has been opened. Did the front door get opened? So you can sort of tell how active a person has been if they haven't use the toilet in an entire day, right? That would be a huge red flag. You'd want somebody to be going in and checking in on that person. So there are some neat technologies for this. Mercury Health is a local provider created for this type of service, created by a few UCSD engineering students. Remote door lock security systems, kind of along the same lines. Quick Lock, ADT offer this, so you could lock somebody's home windows, whatever, remotely, if you're worried that they wouldn't be able to remember to do that. GPS and wandering response systems. There's GPS devices. Of course, we can just use phones and the tiles that people connect to their keys, but there are also GPS devices just for this purpose. That the challenge, they're bulky. They need to be kept charged. Right? It needs to be on the person, right? There are inserts that go in the soles of shoes. There's all sorts of neat technology that's out there. If somebody is at risk of wandering, you may want to consider setting up some type of GPS. And then I mentioned fall detectors as well. And if you have other ideas, other resources, please share them in the chat. As I mentioned at the beginning, resources, links, ideas that get shared in the chat here today, I will include them in the email that goes out to all of you. So if you have ideas, things that have been helpful to you, I'll ask you in a moment here to go ahead and share those with your fellow attendees here today. Video conferencing, of course, over the last year and a half, a lot of us that weren't using it before, we're pretty much all using it these days. People with dementia can absolutely benefit from the use of video conferencing tools. But of course, it will generally, if they didn't use the technology prior, if they didn't use the technology prior to the onset of their memory loss, because of the progressive nature of these conditions and the difficulty with retaining information long enough to learn how to use new tools, they may not be able to. But if you can arrange for a friend, a helper to be on the other end, video conferencing can be an amazing resource for helping long distance caregivers stay in touch. Not just, you can get a little bit more context than you can just by making a phone call or talking to someone else about how someone is doing. You can see around the room, so folks are using, of course, Zoom, FaceTime, Skype, Google Hangouts, but there's also these neat devices that families are setting up now. I hear about families who are keeping in daily contact now through Facebook portal devices that can kind of scope around a room and let you see not just the person that you're talking to, but what's going on in the room behind them as well. So you can check in on the pets if you need to. Echo Show, Google Nest, right? Lots of other technologies available for this. So if you're going to use these technologies, right, set yourself up for as much success as you can, have a stable internet connection on both ends, minimize the amount of distractions. If you can get someone to help turn off radios, televisions, right, keep things kind of focused for the person with dementia. All of this as you're gathering often requires assistance from someone else. So if there's a helper nearby, engage them in that help, and just, you know, take a deep breath, have some empathy, how challenging and confusing some of this technology can be, not only just sort of generationally, if they've never seen something like this before, but also cognitively, how challenging it might be for them to kind of figure out what is going on and how to use the technology. But once they do, this can be a brilliant source of connection for the long distance caregiver. So if you have any other ideas, ways that technology that you have used, devices, things that you've tried or heard about that can help a person with dementia to be safer, to help you as a long distance caregiver get more accurate information, whatever it might be, I welcome you to share that in the chat. We'd love to hear it, that we are always learning from all of you. But again, we will share it out in the email that goes out to everyone as well. So as we go along, feel free to share anything that comes to mind for you. Now let's talk about how to make the most of those visits, right? So with the state of the pandemic, inter-county travel, interstate, international travel, right? We have to take all of this with a grain of salt. At the moment, we are still able to travel and visit with each other in most areas right now. So some tips for getting the most out of those visits. Do coordinate with somebody local if there is somebody. If there's a primary caregiver, someone who lives with the person or is nearby and is primarily responsible for their day-to-day care or, you know, sort of managing appointments and those types of things, don't spring your visit on them, right? Work with them to make sure that it's going to be a timing that works for them, and check in with them in advance and ask, what do they need? While you are there, what could you do that would be helpful? Another good question to ask if you haven't seen the person in a long time is, you know, what do I need to know before I come visit? What should I expect? Have there been any changes in the person's status? This helps you sort of emotionally prepare for, you know, they may look or interact very differently from the last time that you saw them, depending on how long it's been. This can help you sort of steel yourself emotionally for that challenge, but it's also a great show of support to that local caregiver, right? What is it that you need me to know? That helps them to sort of, it can really alleviate a lot of their stress about your visit. It's one of the great dilemmas, I think, for the long distance caregiver. You're going out, you're trying to be helpful, you're going to be a source of support, but often your visit is actually a tremendous source of stress to them, right? Well intended or not. So asking those questions can mitigate a lot of that tension. If you're traveling back and forth to a particular location a lot, I would suggest considering keeping a local set of supplies, your own stuff there, right? A couple of changes of clothes, walking shoes, right? Toiletries, those types of things to just sort of make your life a little easier for all of that back and forth travel. If that's given your logistics, if that's a reasonable recommendation for you. Consider how long your visit is going to be, right? Don't try to pack in all kinds of stuff. I've seen this just with my visits to my family, my long distance family over the years. I've had to expect less of myself and of them, in terms of how much we're going to get done, how many visits we're going to make. Am I really going to be able to see every cousin, right? Maybe not. So do the same with regard to your caregiving types of visits. How much can we really accomplish? Do we need to make a medical appointment with every doctor that the person has while you're there, or should we just focus on one or two, right? Consider how long you're going to be there, how long you should be there, both for your own well-being, but also for the person with dementia and their local caregiver's well-being. How long should this visit be? What's really realistic? And don't forget to attend to your own self-care needs, right? When you are visiting, you need opportunities to like clear your head, get out for a walk, whatever it is that you might need for a few minutes. So make sure you're sort of planning for some of that as well while you are visiting. And one thing we often forget to do is just enjoy the person's company. I think long distance caregivers, because of those feelings of guilt that rack many of us, we get out there and we feel like we have to be in, get stuff done, do as much as I possibly can while I'm here. And there's probably, an element of truth to how much you need to get done. But remember that if this is somebody that you love and they love you back, right, that relationship that you have with them, that's something very unique and something special. That's a role that only you can play, right? Only I can be my mother's youngest child. There's no one else that can do that. So if she needs to feel like she is being mothering to her baby, right, I'm the only person that can fulfill that role for her. Other people in her life, in my life, could do things like take her to the doctor, get her a new pair of shoes, right? But only I can fulfill that particular emotional need that she has, right? So don't forget to also try to spend a little bit of quality time together and enjoy the visit as well. So now at long last, I've been promising to share resources with you. So here they are. We're going to talk through local stuff, and then I'll give you some tips on how to find resources in other areas as well. Of course, if you are outside of San Diego County and you are caring for somebody who lives here in San Diego County, we certainly hope that you will consider Alzheimer's San Diego to be part of your support system and their support system. We offer an enormous array of all free support services, direct services, as well as just sort of informational referral and emotional support services as well. So you can reach out and talk to one of our dementia experts. Ellen, as I mentioned, is one member of our team of dementia experts here at Alzheimer's San Diego. You can locate a virtual support group. Lots of classes. Obviously, you found your way to our education program. We have a lot of topics, both for families and for professionals, currently all online. Our support groups, by the way, are all also virtual at the moment. We have members of our tech team, like our volunteer who's with us here today, Stephanie. We have volunteers that can help families as well. If you want to set up FaceTime or Zoom calls with somebody, they can facilitate that type of technology help as well. We do social activities and outings, limited at the moment, of course, because of safety concerns, but we have virtual activities and we have outdoor, safe, socially distanced outings in the community for people with dementia and care partners. We can connect people to research information, opportunities to participate in local clinical trials. And then I think two programs of particular importance to the long distance caregiver are our volunteer respite programs. We've got our All's Companions program, which pairs up trained volunteers with an individual living with dementia and a care partner to let that care partner sort of step away and get a break for a few hours. At the moment, we aren't taking new referrals for in-person All's Companions visits, simply because of the pandemic. We are doing virtual visits at the moment, but we'll be back to being able to provide in the home companionship visits so that the caregiver can step away and get a little bit of a break, up to 4 hours a week, as with all of our services free. And then we've also got virtual visits that we are doing now and will continue to do going forward. VITALS is our Volunteers in Touch telephone reassurance program. So we have volunteers that make telephone check-in calls to people with dementia who live alone here in San Diego County. So if you're caring for somebody who would benefit from having someone check in, make a social call, but also they can help with things like making reminders about appointments, household tasks that need to be done, that type of thing. VITALS is a terrific resource. So of course, we're only here in San Diego County, but you can find resources like us in many areas, certainly not all, but in many areas. Southern Caregiver Resource Center is another great source of support here in San Diego County. They are focused on meeting the support needs of family caregivers, not just to people who are caring for someone with dementia, but people who care for someone with any type of illness or disability. Southern Caregiver Resource Center here is San Diego County's version of our statewide resource center. There are, I think, 9 different resource centers throughout the state of California like that one. So you can find other caregiver support resources through the Family Caregiver Alliance. That's our state resource. And then Family Care Navigator, caregiver.org. You can find a caregiver resources anywhere in the country. It's organized by state. So you click on the state and then it'll show you all of the different governmental programs that are available, housing information. You can find dementia specific organizations and more through the Family Care Navigator. One thing in particular I wanted to mention, to bring to mind, is a new resource. This is a nonprofit organization that is funded largely by the Department of Justice to address issues of identity theft. People who are living with dementia are particularly vulnerable to many different types of financial abuse and exploitation, unfortunately, something we really want long distance caregivers to be aware of and attuned to. So I just want to tell you about this specific resource. What they can do, they offer a really neat dashboard, a database where you can look up data breaches by different companies, by different regions or companies that your person might be affiliated with, to detect possible breaches of their information. And then they do have telephone support, great online resources. You can talk to a social worker to sort of talk you through if somebody has been a victim of financial abuse or identity theft. They can provide direct support in the person's area. So a major risk for the person with dementia, especially the person with dementia who's living alone, that we wanted to bring to mind. Something that is, of course, of the moment. Hopefully this is not something we'll have to be attuned to for the rest of our lives, but we want to make sure that you know how to find information about what's going on related to the COVID-19 pandemic in the person's area, because you might be able to keep up with what's going on in your own public health department, but how do you know what's safe, what's allowed, what's permissible, what the regulations are for visitations, for example, in a memory care facility in another county or another state? That can be very challenging. So coronavirus-sd.com will direct you to our local public health county public health department with lots of good information about the issues here in San Diego County, but through the CDC's National COVID Information page, covid.cdc.gov. Again, you can look up by county specific data and also the public health guidance in that region. So Alzheimer's San Diego is something special. We think we are a pretty unique organization serving just San Diego County, but I want to make sure you know there are other organizations like ours in some other areas of the country. I've listed for you here the independent organizations like ours that we know of that are out there: Orange County, LA, Texas, Wisconsin, Tennessee, New Jersey, and then a chapter specific to New York City. Those are organizations like ours. We're not affiliated with each other, but they are independent providers of direct dementia support that is regional and local in nature, like Alzheimer's San Diego in some other areas. But there is also, of course, a National Alzheimer's Association. We aren't part of that association. They are a national entity headquartered in Chicago, but with chapters all over the United States and parts of Canada as well. So you can find, they provide a lot of good information, advocacy, and if you don't have a local organization near you, they are a terrific, well, they're a terrific resource for anybody. ADI, Alzheimer's Disease International, maintains a list of associations for dementia support worldwide. Just about every country has some type of dementia support. So you can use that website to look for organizations in other countries as well. Oops, sorry, that's a duplicative slide. I apologize for that one. So we'll take a moment here and pause for any final questions that have come in.
Yes, Amy, I have one question for you. And any suggestions about dementia patients who become aggressive with paid home caregivers? Medications that sedate and calm the patient may also contribute to confusion and overall cognitive function decline. However, it is challenging to find caregivers with expertise in handling aggressive behavior.
Yes, boy, that's a question that's packed chock full of issues there. So yeah, I'm actually going to start with the comment at the end there and work my way backward. First of all, finding a home care company that, depending on where the person is, what state they're in, there's going to be different requirements in terms of home care licensure, whether or not licensure is even required, and how much training is required of the home care workers that work for those agencies. Here in California, home care organizations do have to be licensed. They have to provide a minimum amount of training to their caregiver employees, but only a little bit of dementia education is required of them. Not every good home care worker is good at working with people with dementia. It is a unique skill set, to be sure. So on our list that we maintain at Alzheimer's San Diego, for example, our team of clinical care coaches have done the work of vetting those organizations. We can't guarantee, of course, the quality of any particular agency or any particular worker within that agency, but we have asked the question, what additional dementia training are you requiring of your staff? Do they have access to 24-hour support if they're having a challenging interaction with their client living with dementia? Do they have someone that they can call besides the family, right, to walk them through and provide them with ideas and support? What additional training and support is available to these employees to empower them and to give them the skills that they need to meet the unique challenges of caring for someone with dementia? Because it takes a particular ability to communicate, to provide validation, reassurance, to redirect somebody, to understand the triggers that can frequently cause somebody to sort of escalate and ramp up and be aggressive, and figure out how to minimize some of those and how to redirect that effectively. It can be done, and it can be done without medication in many cases, but it does take special training and special skills and a lot of support. So you want to be asking that question of the home care company: what support is being provided to these caregivers? Sometimes caregivers who are really wonderful can just get supplemental training, right? They're a really great caregiver, but they're really struggling with these behaviors, the aggression. They're not sure how to handle it. So maybe some supplemental training or coaching for the caregivers would be helpful. You might be able to connect them to some online resources for education and training, for example, connecting them to classes on communication skills and coping with challenging behaviors. But then, of course, there is also the medication side of this. I mean, I don't want to overlook the importance of sometimes talking with the doctor, talking with the psychiatrist about upticks in behavioral changes, aggression. You don't want to have an unsafe environment for the person living with dementia or for the people that are working there, right? We can't have caregivers in unsafe situations either. The companies need to pull their employees out when it's unsafe for them, right? So sometimes medication is called for, and there are a lot of medications that can be used carefully, right, thoughtfully, to try to minimize aggression in people who are living with dementia. So a combination of those things.
Thank you, Amy.
Yeah. Okay, got it? Okay, well, we will go ahead and wrap up here. We are right at our time. So if you need more information, I know Ellen has been putting out some links in the chat. And Ellen, I'll just ask you to do that one more time. If you would put out the link for requesting follow-up from a member of our team. You can get information from us 24 hours a day on our website, lots of good disease and caregiver support information there. You can call us or email us or live chat us during regular business hours, Monday through Friday, 8:30 to 5, where we can, there's somebody available by phone or online to answer questions, get you referrals to local resources, or just provide emotional support if you're out of the area and in need of that. And then there is that link that just went out in the chat. If there's something in particular that you need, fill out that request form and a member of our team will follow up with you next week to let us know what you need. If you know, you might not know, maybe just want to talk to somebody, that's okay too. Just provide us your contact information and a member of the team will reach out to you to get you what you need. A couple of additional education programs that are coming up. Not next week, but the week after, we'll be doing our drop-in education hour. These are sort of fun hours that my colleague and colleagues in the education department just hold an hour. We don't have a lecture. We don't have any structure. We don't have any kind of an agenda. It's just an opportunity to ask questions about dementia, about caregiving, whatever the things might be, whatever is on your mind. It's an open hour. It's held via Zoom meeting, so we can all see each other and talk to each other. So sort of fun and a nice resource if you've been watching a lot of webinars and you don't get to ask live questions, you can ask us in person. And then on the topic of that question that was just asked about difficult behaviors, we have a program called Coping with Personality and Behavior Changes that is specific for care partners, and that's coming up on September 1st. So information about those and all of our other programs, of course, is available on our website. So that concludes our program here today. I thank you for sharing your helpful resources with us and with each other. We will be sending those out. I thank you for your good questions and just for being the loving and attentive long distance caregivers that you are, whatever and however you define that. We appreciate the challenges of that role very much, and we are here to help. So please don't reach out. Don't hesitate to reach out, I should say, for support. When the webinar ends, when you leave, you're going to be directed to a quick survey. We always read and appreciate your comments and your feedback on this and other programs. So please, it's anonymous. Tell us anything that you think would be helpful. We'd love to hear it, and we certainly hope to see you again at another program soon. So with that, I will sign us off. I thank you, Stephanie and Ellen, for being here today, and we hope to see you at another program soon.